call 1-833-771-0696 from 9 a.m. to 5 p.m. Monday to Friday, or email COVID, COVID 19 info@gov.nl.ca. If you start to have symptoms of COVID-19, please use the self-assessment tool on the Healthline 811 website to determine if you need to call 811. If you are not able to access the self-assessment tool, please call 811. Our news conference will begin shortly. Our news conference will begin shortly. We would like to thank all the people of Newfoundland and Labrador who have identified their risk for COVID-19 and have self-isolated and gotten tested if indicated. Thank you for doing your part to reduce the risk of transmission to others in your community. Let's come together to support those in self-isolation. Ask your neighbor how you can help. We all have a role to play to reduce the spread of this virus, protect our loved ones and ourselves. Please stand by. Our news conference will begin shortly. From throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for today's question and answer session. For today's event, we are joined at the table by Premier Dwight Ball and Dr. Janice Fitzgerald, Chief Medical Officer of Health. The Honourable John Hagee, Minister of Health and Community Services, is joining by telephone. Please stand by. Our news conference will begin shortly.
Well, good afternoon, everyone, and welcome to our media availability. We will begin this evening's event. Minister Hagee is at his home and will be joining us by phone, but we'll start our event today with the update from Dr. Fitzgerald.
Thank you, Premier. Good afternoon. Thank you for joining us today. As usual, I'll begin with an update on the number of cases in our province. Since the media briefing yesterday, we have 8 new positive cases. These cases are within the Eastern Health and Labrador-Grenville regions. The Labrador-Grenville case is a person who works at the Charles S. Curtis Memorial Hospital in St. Anthony. The public health contact tracing is ongoing, and everyone considered close contacts will be isolated and tested where appropriate. The total number of cases in our province is now 203. By region, we have 133 cases in Eastern Health, 3 in Central Health, 1 in Western Health, and 6 in Labrador-Grenville Health. Of the 203 cases, 153 are related to the Calls Funeral Home cluster. 54% of cases are female and 46% are male. By age, we have 16 people under the age of 20, 26 between 20 and 39, 32 between 40 and 49, 46 between 50 and 59, 42 between 60 and 69, and 41 who are 70 and above. 11 people are in hospital due to the virus. Of these patients, 3 are in intensive care. 18 people have now recovered. In total, we have tested 3,386 people. Today, I would like to express a sincere thank you to the people in our province who have identified their risk for COVID-19 and are self-isolating, and who have been tested, if advised to do so. Your responsible actions are directly reducing the risk of transmission to others in our communities. This is an uncertain time for all of us, and self-isolation and quarantine can further increase the anxiety that many are already feeling. If you know somebody currently self-isolating or in quarantine, I encourage you to reach out to them. Let them know that they are not alone, and ask how you can help. This, of course, does not mean visiting them at home, but could simply mean having a virtual conversation and coffee, sharing a few jokes, or bringing them an essential item if they need it, all while maintaining safe physical distance. We can each do our part by supporting our loved ones and neighbors in self-isolation and quarantine, and by continuing to practice social and physical distancing, proper hand washing, cough and sneeze etiquette, and staying home when we are unwell. There have been questions about testing recently. Identifying cases is important. So to that end, we will be expanding our testing criteria to include those with symptoms who are members of vulnerable and higher risk populations or work with vulnerable populations. Our goal is to identify and prevent the spread of COVID-19 within our healthcare facilities, long-term care facilities, personal care homes, daycares, emergency shelters, correctional facilities, and other housing programs serving vulnerable populations. We will continue to analyze our data and will use the information to inform our testing strategy in the coming days and weeks. This is evolving rapidly, and we want to apply the best evidence to ensure that we are using our testing supplies and PPE in the most effective and judicious way to curb the spread of COVID-19. What we need to remember is that the most important and effective thing that you can do to reduce the spread of COVID-19 is to practice physical distancing and to stay home if you feel unwell. While the terms social and physical distancing have become buzzwords over the last number of weeks, you would not have to search far to find evidence around the world that supports this principle. Yet we are still hearing stories throughout the province about people who have a false sense of security in thinking that COVID-19 is not currently in their communities. People who continue to gather in groups, frequent grocery and convenience stores to socialize, and partake in everyday routines that were once the norm. And although I can't speak specifically about cases and locations, what I can tell you is that COVID-19 does not discriminate. It can and will touch many communities, and it can spread quickly if not contained. Now is not the time to become complacent. As we have seen in recent days and weeks, this virus is rapidly evolving in our province. For people who have been diligent in social and physical distancing, thank you. Please take the opportunity to encourage your family, loved ones, and friends to do the same. help them to understand the importance of staying within their own bubbles and not bursting anyone else's. This is not a joke, and it will save lives. As a recap for those who may have just joined us, we have 8 new cases since yesterday's media availability. The total number of cases in the province is 203. The breakdown by health regions brings us to 193 cases in Eastern, 3 in Central, 1 in Western, and 6 in Labrador-Grenville Health. We each have an important role to play in slowing the spread of COVID-19 in our communities, and protecting our loved ones and ourselves is everyone's responsibility. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Thank you, Dr. Fitzgerald. Well, 8 new cases. This rising numbers is certainly not what anyone would want to see, but it is where we are at this very moment. We have a country now with almost 13,000 cases in Canada. But to our Newfoundlanders and Labradorians, I want to extend my well wishes for those of you and your families that are dealing with the positive impacts of COVID-19. We also want to let you know that the staff taking care of them know that we are thinking about you, and we really appreciate all your work and wishing everyone a safe recovery. Of course, as we deal with this together, we are answering many questions on a daily basis. We've had a number of questions that have come in this week related to children and youth in care, and whether or not supervised access will continue during the COVID-19 public health emergency. Now, a couple of weeks ago, our government was advised of a decision to temporarily discontinue family visitation and supervised access. The decision to suspend family visitation and supervised access for children and youth in care involved many departmental programs, such as in care, kinship, and protective intervention. These decisions were difficult to make, but it's a decision that's consistent with the advice provided by our Chief Medical Officer. It's meant to limit the spread of COVID-19, similar to what we've seen in other provinces. Now, the Department of Children, Seniors and Social Development, this is the department that leads the decisions and implementations on these guidelines. So we also speak and contact the impacted parents, caregivers, foster parents, and children and youth to explain the decision. It's very difficult for children who are 3, 4, or 5 years old, and we've seen pictures of grandparents having to visit their grandchildren and staying outside while looking through a window. If you are 3 or 4 or 5 years old, this is very difficult to explain, but these are the kinds of impacts that we're seeing on our families as we deal with this pandemic. Now, the Department for Children and Care, they deal with those similar situations. So we've reached out to our community partners, our Indigenous governments, our Foster Families Association, the courts, the Child and Youth Advocate, the residential placement providers, to advise them of this temporary directive. And we realize that this is very difficult for children, for youth and their families. We're encouraging the use of different technology, as Dr. Fitzgerald has said. Use Skype, FaceTime, phone, text, email, or other forms of technology that's deemed appropriate. Let's be creative in how you interact with those in care. So they are difficult decisions to make. Certainly we know how important family is during challenging and stressful times. It's during stressful and challenging times that we lean on our families. But today we see that those connections are broken. So to our social workers in partnership with families, our community partners and support agencies, we're considering the needs of our children and youth. There may be from time to time exceptional cases that we may need to consider, but keeping in mind that these decisions can only be made, keeping in mind that these decisions, we must keep our children and youth safe. They can be reviewed and monitored on an ongoing basis, but only reinstated when it's safe to do so. Keep in mind the underlying principles are saving lives. So we've heard from you, and I look forward to a day when we can get back to some sense of normalcy in our province. But we are a long ways from that. Prepare yourselves for a long journey. These are not days or weeks, these are months. We want nothing more to see you spend more time with your families, but this is a prolonged journey. So we said from day one that these decisions being made aren't perfect and they can be tough. But you think about the other option. Think about what would be more difficult if you had to deal with the loss of a loved one. These decisions are made for your health and safety at the forefront. That is our number one priority, and that will not change as we work through this pandemic together. Your response, our response, must be with the province's health and safety kept front and center. So let's continue to work together and keep physical distancing and hand washing our top priority. While we continue to abide by the health guidelines of Dr. Fitzgerald that she's put in place, we want to remind you that we have a number of supports in place. Visit our COVID-19 website. You'll see the trusted and factual information available there. It's updated daily. There's questions there that come to your mind that you can access the easy answers. We also have the 811 Healthline website. There's a self-assessment tool to see the impact of COVID-19 on your life. The Canadian Red Cross is also available for those of you that are in self-isolation who require further assistance. Now we're heading into week 4 for our province. There's been a lot of people that's working nonstop around the clock to keep you safe. Let's continue to look out for one another. The best way to do that is physically stay apart. Stay home, stay 6 feet away from others. The time is now. What we do today determines how the virus grows or dies tomorrow. It moves quickly. Follow the guidelines. You do not want to be the spark of a virus fire in your community. Let's take a hold of it, not allow it to take a hold of us. Thank you. I will now turn it over to Minister Hagey for a few comments.
Thank you very much, Premier. We've heard Dr. Fitzgerald again announce a further development of new cases involving healthcare facility. I want to address a couple of issues that have cropped up and tie these together. Our testing, as Dr. Fitzgerald has mentioned, is aligned and resourced on the basis of the best available evidence. If that changes, so will we. It is targeted to provide protection for the workers in healthcare and also for our vulnerable populations. But what do these results mean? I mean, a positive result means stay home. A negative result means still stay home. And whatever you do in any case, if you are sick, stay home. The only safe assumption to make is that the virus is here and it's near you. We have talked about distancing and what that means. Yesterday we referenced keeping the number of face-to-face contacts as low as possible during your day, and ideally less than 3 a day. This delays the arrival of the peak and reduces its size. Because when our numbers begin to climb, they will do so very rapidly, without warning. And when that happens, and when the peak arrives, the capacity we've been able to generate over these weeks will be pretty well what we have to rely on at that time. So by delaying the peak, by distancing, we actually buy ourselves further time now to prepare. And those preparations are continuing through the weekend in the regional health authorities as we alter our buildings and our flow of patients to be able to cope when this arrives. It's not if, it's when. One of the other things that was brought up yesterday and has been active in social media has been the issue of visiting of loved ones in healthcare facilities. The only truly safe option for visiting is none. No one at all, at any time, under any circumstances. But being human beings and recognizing the fact that this is going to produce huge emotional burden all round, we have spent a lot of time trying to alleviate that. So we've really tried through our policies to give as much as we can. We've not set out to try and remove as much as we can get away with. We're not trying to be difficult in these circumstances, but it is a balance. It is a balance between safety and those people in the public who are crying to keep healthcare locked down, and those who would want, for reasons of emotion and comfort, to visit at will and as often as they like. So we have these policies. We amend them on the basis of best advice. They're driven by safety, but they have to be applied across the board fairly. We can't be making exceptions and exemptions, because that just then leads to the next request for an even further exemption. And quite frankly, if you look at other jurisdictions, when the wave arrives, they lock down. The only way we're going to end up revising these in the short term and the medium term is more than likely to restrict them completely. Harsh as that may sound, the underlying principle is, as the Premier and Dr. Fitzgerald have both said, the safety of all of us. It's been a busy weekend with the arrival of checks and GST, and I was heartened to see in Gander that the stores there are really focused on social distancing. They are limiting the number of people in the stores, they are wiping cart handles, and people outside are queuing 6 to 8 feet apart. Unfortunately, I'm also hearing in other rural areas that this is not the case. And that is a risk not just to them, but it's a risk to all of us and the people in their immediate vicinity. The hours of stores really are key for our essential workers, and I know there is an urge to restrict it and shut them down. But quite frankly, from a public health point of view, the more opportunity there is to get shopping done over longer hours, the safer it is. It would certainly help our essential workers. But again, it is a matter of risk and balancing. Other discussions in the department with occupational health and safety are around the businesses and the safety of the workers in those businesses. And these are ranging from retail and grocery and essential services like that, to discussions now around how you can safely fish and keep 6 to 8 feet apart on a small boat. Those discussions are not concluded yet, but it's going to be a challenge for sure. The bottom line for all of this is what we do now matters. We need to be good about our physical distancing. We need to create that bubble of protection around ourselves and our families. We need to stay in that bubble. And when we do have to go out for essential services, we need to make sure we don't burst anybody else's. What we do now creates capacity to deal with what will come in the coming weeks. So with that, I conclude today's remarks, Premier, and hand it back to you.
Thank you, Minister Higgy, and we now open it up to the media for questions.
For the benefit of our speakers, we have 7 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. We will run through the telephone queue, so each reporter has an opportunity. Following this, should time permit, reporters can ask single questions only. This call will end at 2:59 p.m., and further questions can be emailed. Operator, please proceed.
Thank you. We will now take questions from the telephone line. If you have a question and you are using a speakerphone, please lift your handset before making your selection. If you have a question, please press star 1 on your telephone keypad. If at any time you wish to cancel a question, please press the pound sign. Please press star 1 at this time if you have a question. There will be a brief pause while the participants register for questions. Thank you for your patience. The first question is from Kellyanne Roberts from NTV News. Your line is open.
Thank you. We know that the regions in the province are quite vast, and we know majority of the cases reside in the Eastern Health region. Is it possible to get a further breakdown if many of these cases reside outside the metro area?
Hi. So certainly what we do know is that while we do have cases, a majority of cases within the metro area, there are certainly cases outside of the metro area. That breakdown I don't have. We can certainly get that information, but it is not just a towny phenomenon, we'll say.
And then looking to...
I'm sorry to interrupt. This is the operator. Before we continue, it's the line of John Agee that is ringing if someone is with him, or I could disconnect the line entirely. I will disconnect the line of John Agee and he can call back. You may go ahead, Ms. Roberts.
For the sake of those of you that are viewing right now, is what we're not receiving would be the questions from the media.
I'm very sorry, it's the operator, so we'll continue with the question period. The next person is Alison.
Excuse me.
Yes.
I would like to have Dr. John Hagee reconnected to the line. So, Minister Hagee, if you could please call back to the number that you were provided, we'll have you reconnected.
I'm back on the line now, Thank you, Kathy.
Thank you.
So the next question, I will retrieve Kellyanne Roberts if she did not have time to retrieve our question. Please go ahead, Ms. Roberts.
Thank you. Sorry. I'm wondering about the testing in Central and in Labrador-Grenfell, knowing that there's community transmission and how that testing has evolved.
The testing numbers across the province are pretty good per 100,000 compared with the Canadian average. Our provincial average is 633 people tested per 100,000. For Central, it is lower than that, however, and Western. They are down at 312 or 361 per 100,000. We are focusing on contact-based testing, and the testing is targeted. That would explain those lower figures in Western and Central.
Thank you.
Thank you. The next question is from Alison King from BOCM News. Please go ahead.
What is the uptake on the mental health crisis services in the province?
That's a very good question. We have resourced Channel's Warm Line further, and we have been promoting very actively our web-based services through Bridge the Gap. That's 2ps.ca. I don't have the numbers to hand, although I do know that Channel and the Warm Line have had an increase. I can get them for you, and maybe we can email them to you later on, perhaps tomorrow.
That would be great. My second question is for the Premier. The Indian Nation is calling on the federal and provincial government to shut down access to Labrador. What is your response to that request?
We've had some discussions with a number of groups throughout Labrador, which would include the combined councils. It would include, officials in Labrador West as well as in Central Labrador and some of the Indigenous groups. I did receive a letter yesterday and a call also to the Prime Minister. He's been made aware, or they've been also called or sent this letter to the Prime Minister as well. So some of the things is really trying to find a balance of, so what we've been asked to do is just really shut down all travel into Labrador. But we must all be mindful that there are essential services that we do continue to supply for Labrador. As an example, I would give an example in the community of Napwishish and other communities where we provide social workers who deal with, children in care. So simply just, shutting it, taking out all air service, which how we get essential workers in, could have a major impact on other services. So we're working with the Indigenous groups to make sure that we can provide a safe service, as an example, to children in care, as I mentioned this in my preamble as well. So it's important that as we take measures, that we must also consider what the impact would be on the old community as well. So right now we have a limited number of air traffic that will go into Labrador, and we're keeping a daily track of this. So at the end of the day, it really comes down to non-essential only, travel only if you must, and we'll continue to explore, working with the Chief Medical Officer, what the ideal response would be for areas like Labrador and other areas of the province.
Okay, thank you.
Thank you. The next question is from Elizabeth Whitten from All Newfoundland and Labrador. Please go ahead.
Thank you. We're now into the third week of the public health emergency, and are you seeing any evidence that punitive measures like fines and potential jail time work in changing people's behavior and stopping the spread of COVID-19?
We have fairly significant penalties in place for infractions under the orders that Dr. Fitzgerald issues, and they range from $500 to $2,500. Plus or minus a 6-month jail sentence for individuals, and for businesses they can go up to over $100,000. And each day of infraction is regarded in the Act and stated as a separate offence. Those are amongst the most severe that you'll find across the country. As yet, we have, from information I've received from the RNC and the RCMP, we have yet to have the need to do that. I do see the social media posts just as anybody else does, but really Facebook is not the way to report these infractions. There is a form on our COVID-19 government website. These are investigated by the RNC or the RCMP. And as of yesterday, which is the latest date for which I have data, there were only 4 outstanding issues waiting to be resolved.
Right, and that works into my next question. I've heard that people are actually reluctant to use the online form to report people because they're often friends and family members. So what do you have to say to that?
We all have a responsibility. If you're not prepared to talk to your family members about infractions, where's your role in this? There is a part for you to play. If you want the police to do it for you, you may have more inter-family problems than most. But the facts of the case is that it's up to each of us to call out this behavior in a responsible and respectful way. And at the end of the day, even the approach of the law enforcement is first to educate, secondly to encourage, but only finally to enforce. We all have a role to play in this, and it can't just be laid at you can't police your way out of this epidemic.
Thank you.
Thank you. The next question is from Heather Gillis from CBC News. Please go ahead.
Hi there. Last week we spoke about community transmission, and we haven't heard much about that since. What can you tell us about the status of community transmission in the province right now?
So there is community transmission in the province. Many of these new cases, of course, the public health investigations are ongoing, so I don't have information about these. And public health, through contact tracing and through their investigation, work very hard to find out what the source of infection is and to try to make connections. However, we have had some cases of community transmission.
I want to move on to PPE. You had a discussion yesterday about a shortage of PPE in the province. Will healthcare workers be asked to limit how much they can use per shift, or can you describe what will be happening in that situation, please?
Certainly. PPE is in short supply across the globe. This is partly a reflection of how and where it's manufactured. A lot of the components, for example, of N95 masks are made outside of Canada. There's very few of them that are actually made inside Canada. So we have several things that we have done to approach this. Firstly, we have used our conventional supply chain. Secondly, we have used a federal provincial buying mechanism where Canada buys as bulk. Bigger purchase has better traction in the market. We have also got the National Emergency Strategic Stockpile. We also have reorganized the procurement for COVID-19 under a single experienced civil servant. And then finally, we have the entrepreneurs, as it were, of Task Force NL, who are also working on sourcing and also manufacturing. In addition to that, we have been engaged with the RNU and with NAPE and allied health professionals and QP and all the unionized staff who work in healthcare in general to explain what we view on the basis of evidence is appropriate use of masks and PPE. Not everybody, healthcare worker or patient, requires an N95 mask. There are other safe, available substitutes for that. And I think we need to make sure everybody who has access to PPE and needs access to PPE knows what the right mask or the right PPE is for the right patient in the right environment. And so that will be an important part of our efforts.
Sorry, Dr. Haggie, my question was, will staff be asked to limit their usage?
Staff will be asked to use appropriately. At the moment, the rate of burn through the PPE that we have with current evidence-based guidelines is matched by the rate at which we're resupplying.
Thank you. The next question is from Anthony German from CBC. Please go ahead.
Question for you, Premier. You have given a guarantee to all public servants that they are not going to lose their jobs. And my question is, how is this fair during a pandemic when it's no longer business as usual? Thousands of others are losing their jobs. Why not lay off some of those workers and have them apply for EI like everybody else?
So the important thing here, Anthony, is make sure that we do the best part that we can to come through this health crisis, and as we then deal with the financial crisis that will come right after this. We recognize this province is in a difficult situation. We talked about this, but our priority is to deal with the health crisis today. We still have a large number of public health or public sector workers that are working from home, and so for government to lay off a large number of public health workers or public sector workers and put them on EI right now would lead to would actually make the financial crisis even worse. That's the estimate of where we are. Of course, we want to do the best we can and as working through this, but imposing layoffs on a public sector workforce right now in the middle of a health crisis, I don't think, for our analysis, would be the right decision at this time.
But given that you recently made public the fact that you couldn't make payroll, I mean, isn't it, whether we're in a pandemic or not, it's as if we just simply can't afford this? And I wonder, how do you justify forcing the shrinking number of people who do have jobs in this province to pay the salaries of government workers who you've guaranteed are immune from letting economic circumstances cause them any kind of discomfort?
Right. So we're working with the federal government, as other provinces will, of course, and we know now within the next few weeks there will be relief giving to those that have been laid off as well, relief for businesses, for employees as well, through a number of different programs that the federal government are putting in place. We've also set aside from the provincial government a $200 million contingency fund. So we're looking at all the options that we have available to us right now, but a mass layoff of public sector workers in the middle of a crisis would actually be, would we feel, coming into the financial crisis, would make the rebuild and the restart that much more difficult.
Thanks.
Thank you. The next question is from Angel Moore from APTN Network. Please go ahead.
Thank you. Going back to the request from the Innu Nation and the Combined Councils of Labrador, they're asking that if the Labrador entry into the area will be only for essential services, and does that include people coming from the island, due that the big clusters are mainly in the island of Newfoundland, and only because they're concerned about their communities. And then my second question is about children in care. What will happen about children who are in care that age out during this pandemic? What will be in place to help them out so they just don't end up with nowhere to go?
Well, to your second question, we're going to continue to provide whatever services we can for those that age out or would age out in this particular, working through this pandemic. You know, what we do know that, you know, when it comes to age restrictions and people aging out, there's going to be an overlap that we see here. So we're not about to leave any child simply because of a date, a birth date, that will be without services. We're going to do the best we can to continue to support those children. On your first question about essential, non-essential workers, we're seeing some areas of, even within Labrador, of communities within Labrador that really do not want to see any travel at all. And so this can actually can cause some problems in certain communities, simply because that would mean social workers would not be able to get in there to supply critical childcare needs. Now, the fact is, we're working with those areas to see that if indeed we were to make that decision, what would be left there, how the services would continue. So it's dealing with the COVID-19 crisis, but also dealing with what would happen in the aftermath of not having those services provided. Now, in the other parts of Labrador, if I mentioned Lab West and into the Straits area and central Labrador as well, we know now that there's very little traffic going in there by airlines. So we're keeping those numbers. We have people that monitoring what's happening within our airports, what's happening at the border, both in the Straits and in Lab West. So there's a fair amount of activity that's going on there to identify the information. I did speak with the president of the Combined Councils, the MP, the MHAs that we have working on the ground there, as well as a number of community leaders. And so right now we feel that, you know, the best thing that we could do is continue to monitor, continue to educate, because in fact we have other areas of the province, you know, that have low numbers as well. So just segregating and cutting off areas of the province from one region to another can cause some other problems. So we want to do what's best and to stop the spread. But the fact is we have a solution, we have a tool for this, is keep physical distancing, stay 6 feet apart. If you go to work, practice and employers are responsible to put the safe regulations in place. So we can stop this spread by simply complying to, or slow down this spread simply by complying to the guidelines that are already in place.
Thank you. The next question is from David Mayer from The Telegram. Please go ahead.
Hello there. I'm wondering if Dr. Fitzgerald could explain precisely why there was a change in the testing methodology announced today, and do you anticipate a spike in numbers as a result?
So the change in testing had to do with us looking at our vulnerable populations, looking at what was happening here, looking at what was happening elsewhere in Canada, and making a decision as to who we needed, where we needed to focus our energies with regard to testing. And so we did that, and focusing on vulnerable populations, long-term care facilities, personal care homes, healthcare facilities, and other residential type facilities as well, and vulnerable populations. So that was the focus. Certainly over the coming days, we will be reevaluating and reanalyzing information and trying to decide then how we need to expand testing. Certainly as time goes on, we will want to do that. But we also have to remember that the test itself is not the magic bullet. While it does help us to find cases and to help with contact tracing and all of that, the fact of the matter is if you have symptoms, the best way to protect those around you is to make sure you stay at home and to self-isolate.
On the expansion of testing, I'm wondering, is there any thought of kind of random tests, within communities to try to track down cases of of community spread? Is that kind of a last resort measure, or is that on the menu at all?
So just random testing of people who don't have symptoms and things like that. Is that what you mean?
Yes, like random testing within the community.
Yeah, at this point, no, that's not on the. That's not in the foreseeable future. We need to focus our energies right now on people who are symptomatic. We know that the majority of spread happens from symptomatic people. So we will be focusing on that, and then focusing on people who are close contacts of any cases, focusing on any cases of symptomatic people with influenza-like illness in long-term care facilities, acute care facilities, healthcare workers. These are the important people to focus on at this point.
Thank you.
We now have about 3 minutes left for questions, so we'll take some single questions from the reporters on our lines.
Thank you. The next question is from Kellyanne Roberts. Please go ahead.
Thank you. Minister Haggie, I believe it was last week you spoke that we were still admitting 11 people a week due to influenza. Are we still admitting as many, and how is that impacting our preparedness for a peak of COVID?
Those are snapshots that are provided to me at weekly intervals. I haven't had this week's yet. We do know for sure that we, this time of the year, experience an uptick again in flu cases. We have prepared for that in the past, and indeed we were ready for it this year. The supplies that we would use for those influenza patients obviously are the same that we would use for COVID-19 patients and testing and this kind of thing. So that's certainly a challenge. What we do have at the moment, which we don't usually have, is a really significant improvement in hospital bed accessibility. The provinces now, across the province, we have an average bed occupancy of around 48%, which is a record low. So we are creating what capacity we can. The key here again is that delaying the arrival of the wave of COVID-19 by distancing, which is our only really effective tool and will always be our best tool, that delay allows us to create more capacity to deal with both flu patients and COVID patients.
Thank you.
Thank you. The next question from Anthony Germain from CBC. Please go ahead.
Premier, a political question for you. The police yesterday executed a warrant and seized some property belonging to one of your cabinet ministers. The Justice Minister is now advising you to get this minister's resignation for allegedly breaching cabinet confidentiality.
Anthony, this question is not related to the COVID-19 situation.
Well,
I suggest you email that to me later,
I
please.
I beg to differ. If you have a cabinet crisis during a pandemic, that's a news story.
We do not have a
news
cabinet
story, but
crisis.
it's a question that can be sent to us after the news conference. This news conference is for COVID-19 questions only. Thank you.
Thank you. The next question from Alison King from BOCM News.
What is our current capacity across the province for ICUs?
Sorry, the current capacity across the province, our ICU occupancy currently is just over 50%. Our bed census for ICU beds under ordinary circumstances is 98 across the province, which puts us on par with the Canadian national average. We have the ability, should the need arise, to convert non-ICU beds into ICU beds, and that's part of our contingency planning and preparation. As far as ventilators are concerned, we have at least a 50% excess of ventilators over current stated ICU beds, but we've ordered more.
All right, thank you.
Thank you very much for tuning in. The time for questions has ended. Please tune in tomorrow at 2 o'clock, 1:30 in Labrador. Thank you.
This is Rogers TV.
Today in my kitchen we have the battle of the charity fundraisers. We know they can grant wishes, but can they cook? Hi, welcome to Scoff Off. I'm your host, Brenda O'Reilly. Scoff Off is a lighthearted cooking competition where we take 2 guests, secret basket of ingredients, and 20 minutes on the clock. And today we have two fantastic guests that both work with the Children's Wish Foundation Newfoundland chapter.
Absolutely.
So we have 2 very kind guests today.
Yes,
this is a competition.
We're not going to be kind to each other
here.
Okay.
No, it's cutthroat here today.
No,
Barry Fowler, of course, is the executive director with the Children's Wish, and of course we have Dave Welch, who's a development coordinator. Right? Is that right?
Yep,
okay.
That's correct.
All right, guys. So, do you cook at home, Barry?
When I have to.
Only when you have to?
Only when I have to.
Really? What do you normally cook?
What's in the fridge? When I have to.
Well, that's good. You can think on your feet then. So, Dave, sounds like you might have a little bit of competition. What about yourself? Are you the...
Yeah, I'm the cook in my house for sure.
Right.
I enjoy cooking. It's one of my one of my newfound pastimes, I would say, and I'm trying to get better in the kitchen, and I'm looking forward to some spirited competition today.
Oh my God!
So around the office, do you guys do anything competitive? This is going to be a fun thing because you can take it back to your office and brag about who wins, right?
Well, we are fundraisers, so we're always trying to raise more money than the other. So there's that point.
Yeah.
So as you can see, we got 2 fantastic guests. When we come back, we'll open up the basket of ingredients. Stay tuned to Scoff Off. Welcome back to Scoff Off. Okay, guys, before we open the basket, the pots and pans are all over here. If you don't see something you need, just ask me and I'll tell you where it is. Over here is the extra pantry of items and the fridge. So you have access to all those things. You have to use the ingredients in your basket to get full points for that. So the points work this way. There's 30 points in total, 10 points for use of your basket ingredients, 10 points for taste, 10 points for presentation.
Presentation as well.
And so you got 20 minutes to cook the dish and present it. I will count you down at 10 minutes and then 3 minutes and onwards. Okay, so let's open your basket.
Oh God!
Here comes the heart attack moment.
The trout basket.
The trout basket, yes. Okay.
All right, so what have we got here?
Oh, hey!
Okay.
I've
so
seen
we
this
have,
before.
Some feta.
Feta.
Some feta. I like feta.
Okay.
I do. Feta.